Welcome to Herbally Yours, an adventure into the world of natural medicine. Here is your host, Dr. Ellen Kamai, the natural nurse who will help you take the leap to ultimate wellness.
Greetings, and thank you for joining me, Ellen Kamai, the natural nurse, for another edition of Herbally Yours, right here on the voice of Nassau Community College, 90.3 WHPC. Listen live on air or online at iHeartRadio, Odyssey, TuneIn app, smart speakers, nccradio.org, or download our own award-winning WHPC app and listen to all the shows on WHPC. Herbally Yours brings you the latest information about the many facets in the world of natural living. Today, I am so happy to have as my guest Dr. Miriam Rahav, who's a medical doctor and triple board certified physician in the fields of internal medicine, hospice and palliative medicine, and functional medicine. She is a graduate and practitioner of the metabolic approach to cancer, trained by Dr. Nasha Winters, and Dr. Rahav is also certified in acupuncture through the Tri-State School of Acupuncture. Additionally, she is trained in a diagnostic and treatment modality called autonomic response testing and neural therapy through the Klinghardt Academy. Dr. Rahav is Miriam Rahav, MD, is the founder and medical director at Rahav Wellness, which is right in New York City, which is great for our local listeners to find out about. Thank you so much for joining us today, Dr. Rahav.
It's a true pleasure and honor. And thank you, Ellen Kamai, the natural nurse, for the incredible body of work and contribution you've made to our field. You are truly the giant whose shoulders I stand on.
Well, thank you so much. I certainly have been doing it quite a while. And I love in your bio that I know many of the people you have studied with, such as Dr. Klinghardt and others. So it's great that you're actually having a center making these really excellent integrative therapeutics available for the public. How did you get started on this path?
Oh, thank you so much for asking. It's been a long journey and a meandering one, actually. I actually started in the field of education as an educator, and I got my first job teaching right while I was still in college. I interviewed for a teaching position in a school in Tokyo. The day after I finished college, I was on a plane to Tokyo and taught there for a couple of years and encountered some health concerns. Although I had no framework of understanding what they were, many years in hindsight, I realized that what I was picking up in Japan was actually mercury toxicity. And that leads me to a little break that I took after working in Tokyo for 2 years, where I went to Thailand just to...
Well, let me ask you one thing. Do you
Yes.
speak Japanese?
少し日本語話せます。
It must mean yes. So that's another whole, opens another avenue of understanding to you.
Oh, language is such an amazing thing. And the Japanese language is so incredibly visual. And the whole system of ideographs, the kanji, or in Chinese, the hanzi, is how, we have this back and forth about language changing our brain or our brain changing language. And definitely learning language and learning to think in other ways is a whole conversation about neuroplasticity and about different paradigms. And I think it's very astute of you to pick that up, because I think the traveling or living in different countries and seeing how different systems and different thought systems operate definitely contributes to being able to look through paradigms or to integrate different paradigms. The more experiences we have, the more modalities we have, the more creative the cross-pollination between fields can be. And I think that's definitely that initial background that I had that was not tied to medicine, but became tied to creative implementations of medicine ultimately.
Right,
hopefully.
which we see in so many cultures. What just came up for me while you were talking is, like those letters, even the Chinese letters, which have a meaning and they have a pattern and an energetic essence. And when we look at the Indian culture, they have special drawings that they'll use, like yantras, which symbolize, actually hanging on the wall to create an energy field that could be healing. And when we look back to Hildegard, I don't know if you've ever studied Hildegard, begin her work from Germany is amazing because she did paintings that were very, very similar to those yantras. So we see a repetition of what we know to be healing essence, which seems to be so lacking, unfortunately, not to insult you, you're a doctor, but from mainstream Western medicine.
Well, I think you're speaking also to, so I haven't studied Hildegard, but thank you because I'm endlessly a student.
Okay.
I'm endlessly a student. And I think part of the learning is, every day I am so humbled by what I don't know, that endless exploration, but even more broadly, speaking to energetics within medicine, speaking to creating a healing space and what that means visually and energetically, frequency wise, right? And so images, sounds can carry a frequency, right? And we want to set that frequency intentionally in service, in compassion, in a special kind of love. I think that healing represents loving compassion.
So I would say that part is really appropriate for the fact that you were linked to the hospice teachings as well.
Mm-hmm. Yeah. I mean, that's such a special space, crossroads, right? Where mind, body, and spirit really intersect in such a conscious way. They're always intersecting. It just becomes a space where maybe we're given more official permission within the medical space.
That's a great way to put it. You're actually given permission to just be supportive without being invasive, which is great about hospice. So,
what a joy it is to speak with you. Speaking of frequency.
Yeah, but I'm just surprised our paths never crossed. I just found you somewhere on a website and said, wow, she would be a wonderful guest for our show.
Oh, I'm so grateful for this connection. It's really wonderful.
But you actually do have a center in Manhattan called the Rahav Wellness Center. Is that true?
Mm-hmm. Yeah, Rahav Wellness. We called it the Center for Collaborative Healing. And it is really, a collaboration between what, I renamed in my mind in a conscious way. I'm not working with patients in the sense that of how the energy is flowing top down, but in a partnership, in a collaborative partnership with another human being who wants to feel better, do better, and the energy really flows both ways. And so it's reflecting that collaborative name in our title, reflect the energy between me and the healing partnership that I'm creating with co-creating rather with every person I'm so honored to work with, and also within members of the team and also with other providers in the community, right? So this is a case in point where we find each other, we meet each other, we identify the resources and the information and the skills that we carry, and then we become a resource to the community, be it educational, be it treatment-wise, be it a testing modality, but that we're all part of this community striving to be better and utilizing whatever resources we have.
And I think you're familiar with where I worked, which was called the Corsello Center for Complementary Medicine. And I was actually the head nurse there for 23 years with Dr. Serafina Corsello. So, we had a very similar kind of center, and it was on 57th and 7th. It had to be there because the minute we got off of work, Dr. Corsello, I have to say, dragged me to Carnegie Hall because she was the one really into classical music and that kind of singing, and that wasn't my first love. I would go more like to a rock and roll Grateful Dead club, but nonetheless, we lived basically right next to Carnegie Hall because she felt that music was so much a part of the healing for her. So tell us what happens if someone were to decide to come to the Rahav Wellness Center. Do you do things in terms of interventions, evaluations online, or do people have to physically come there, or is both available?
Well, it's been an evolution. I think COVID changed a lot of how we all practice. And so it was really centered around people coming in, extensive forms just to get to know someone before they come in. And we actually really read those forms. I really want to know who someone is. What they've tried that's worked, what they've tried that hasn't worked, what their symptoms are. And we ask questions going all the way back to a birth history. asking people if they feel that their life is spent, their time is spent fulfilling responsibilities, or if there's also a sense of meaning and purpose. We have a very kind of full spectrum questionnaires that we look at, and then I get to meet that person in person. And the first visit's really dedicated to learning more about that person, but also the physical exam and also the energy exam that is informed by Dr. Klinghart's beautiful work that he had created with Louisa Williams, an ND and a chiropractor back in the day, which is really about the field, that so much of our body's wisdom is held in the field. And the most important core wisdom there is that all healing takes place in the parasympathetic when the body is regulated and the nervous system is regulated. And so we can have maybe the right supplements, but there are so many other things that can pull a nervous system out of dysregulation, be it emotional, be it frequency wise. So we're dealing, all of us, with a lot of electromagnetic frequencies, certainly in New York City, that can be really dysregulating, and sometimes just getting people's phones away from their head or their router away from their bedroom can make a significant difference on the healing journey. So it's a lot of the work is about creating consciousness.
So how long is that visit? I mean, this isn't the 7 minutes. And unfortunately, you would agree, I think there's an awful degradation of medical practice to what unfortunately many doctors do is come in the room. They have 7 minutes. During that time, they spend most of it in front of a computer screen looking for the billing code of whatever the client is discussing about what's wrong with them on the other side of the room. Then they put in that, and once they get the billing code, then a drug formulary is printed out, and that's it. And it takes 7 minutes. Goodbye.
We all know that the system is terribly broken. I expect that your listenership will be very aware of system failings. And I think it's really important to say here that those system failings are failing providers as well. I really trained with the most incredible, smart, dedicated, and devoted people. And I think kind of wrapping up the connection of how I came into this world a little bit differently, and came into the world of medicine already as an educator, I just had maybe little inklings of awareness that the system felt to me to not support the real human and the real heart-centered reasons that people were getting into the field in the first place. And it becomes kind of a creeping non-choice when you have to just get through tremendous workloads, and the system is set up that you have to just run to fulfill your responsibilities. And all of us want to be good, quote unquote, or please our supervisor, the people who are overseeing us, and be pleasing to them and meet expectations. And oftentimes to meet those expectations, it comes at the expense of that human connection with the person who we signed up to serve in the first place. So it's really a devastating system. And one wonderful chiropractor who I went to some business management training, because doctors, by the way, don't get any training in business. We're really expected to be part of the system. We don't really get training to be outside of the system. So it took some investing and thinking about how I could become the change I wanted to see and create a medical practice and get the support. And so I met this wonderful chiropractor, and he said something to me that has stayed with me ever since. He said, people don't fail, systems fail, and systems fail the people within it. And so the time is nigh for all of us to think about systems changes. And the practice that I've been lucky enough to start is such an endeavor, and hopefully an endeavor that can continue to grow and be shared amongst people, like-minded people wanting to create system changes. There are a lot of us out there, actually.
There are. And I want to remind our listeners that you are listening to Herbally Yours on the voice of Nassau Community College, 90.3 WHPC. Listen live online at nccradio.org or on iHeartRadio or any other podcast venue that you enjoy. For more information on today's guest or topic, you can send us an email at whpc@ncc.edu or get in touch with me at naturalnurse.com. And today we are so happy to have on board as our guest Dr. Miriam Rahav, medical doctor, and she specializes in functional medicine. And she has a clinic right in Manhattan, which is called rahavwellness.com. And you can listen to the show online after you hear it on the radio. It will be posted as an archive, and there'll be live links so you can find her center right away. And you just talked about the extensive intake that you do with each client. Then what would be the next step if someone's coming through that program?
Intake, meeting someone, physical exam, energy exam. You asked how long that first visit with me, because I take time for those being on the table with someone is 2 hours.
Which I want to say is actually the norm in integrative medicine. And what you need to even begin to understand a client or a patient.
Yeah. And it barely scratches the surface, honestly. It seems like such a vast amount of time, but it's, to capture a whole human, I say every cell is a planet and a being is a universe. And to try to capture the universe in 2 hours is obviously funny. But we do our best.
Well, it beats 7 minutes, that's for sure. So what are some of the, biggest health challenges that you see that are, with us today?
I think that in broad strokes, what we're really looking at is that there are so many environmental drivers of dis-ease. And the medical paradigm as we know it does not hold space for that. When you start expanding the menu of what is being looked at, when you look more broadly at things like nutrients, just vitamins and minerals, when you start looking at heavy metals, when you start looking, and it takes time, right? Therefore, the time. What are people eating? How much are they shopping themselves? How much are they buying organic? That's a whole other rabbit hole we can go down. How much are people cooking for themselves? What's going in and what's around them? How much dry cleaning? Do they have sensitivities to chemical smells? You start expanding the menu of what is part of a medical intake. What's their dental history? Do they have silver amalgam? You just start looking at potential exposures. And what emerges over and over and over again is that people are really drowning in environmental injury. And it's we're pulling the veil off of these things. We're discovering that these things register in the body. And that is one of the biggest pieces of the puzzle. Makes it so hard for people to heal until we get really conscious about what is truly driving an imbalanced process, which is what illness is ultimately a manifestation of profound imbalance.
And so little of that is spoken about in mainstream, but little pieces sneak through. For instance, over the last this month, they're talking about aspartame being toxic. I wrote an article about that in the 80s. But it's actually on the main news. But that's one little chemical that's in so many things, almost anything that's called sugar-free.
Yeah. It goes on and on. What I worry about with that is that the things of yesteryear that were marketed to us as being healthful wind up not being helpful. And so moral of the story there is that the closest we stay to our origins and to what is made, by nature, made by, closest to what our ancestors would recognize as food is the safest. People ask me what diet I recommend, and I really like what Michael Pollan wrote in Defense of Food. Eat food. So those are the things that our ancestors would recognize, not too much, mostly plants. I think summarizes it. And there's no room in there for things like aspartame. We're looking at shifting a paradigm, and what's good for me is good for you, and what's good for you is also good for everyone else. And that things that are centered around marketing or profit, we should learn to look at with maybe a more skeptical eye, as history has taught us over and over and over again with so many food fads, with so many marketing ploys. It goes on and on and on, doesn't it?
It's true. But if people feel motivated to come to your clinic at Rahav Wellness, I would imagine they are motivated to take your advice. And you cannot, I'm sure, even after that first 2-hour intake, have them change their whole entire life. So we used to actually only give 3 suggested changes per visit. It might be just do not stop eating this, but consume more of this, something very small, and then more, not 100 bottles of supplements to start out with.
Right. I think one of the tools I'm really grateful for as far as that is the autonomic response testing.
Tell us
that Dr.
about that.
What?
Tell us
and
about
Louisa
that.
Williams brought to the world, because it's really a kind of triage of what's the most important thing.
Right.
And frequently the most important thing is for people to have liver support, detox support, our vital organs of detoxification, plus figuring out what is the vector for some of those stressors coming in. And yes, you're right. The people who do come to me are motivated for change. And they're also very savvy, and tend to be very educated and literate and health literate, and they want to become more so. So I really get to work with the most fantastic people ever.
Because they're not, usually you're not the first stop. Many of the people who will reach out to someone with your level of knowledge have not been helped by that, 7-minute, take this drug, that drug, and goodbye. They tend to get worse, and then they're told that they have to go on anti-anxiety medication because they're anxious about the fact that they're not better. But there's been really no healing that has gone on with them. And then they might reach out to, the Rahav Wellness Center, and really it makes sense to them when you start uncovering a lot of these influences that other people can live with, but maybe they cannot in terms of feeling well.
Well, spoken from the voice of experience, Ellen, sweetheart. As an experienced clinician who has been watching this pattern, people
so when
now
do you
are overwhelmed.
Think? Do you know that it's actually true that the NIH right now has a big program called Food is Medicine, and I've been on many meetings, which is very exciting, to where they're saying the kind of medicine that Dr. Miriam Rahav is doing is all evidence-based, and that it should be, because it's actually the least expensive over time. It's the least toxic in terms of repercussions rather than pharmaceuticals, and it really works. All the evidence is there, and they are trying to promote the kind of medicine you are doing to be standard of practice. Not that we'll throw out drugs and surgery. I'm sure you agree. There are times and places where a drug is the answer, especially temporarily, or certainly surgery. A child has a hair lip. There's no energy work that's going to make that disappear.
Indeed.
So we need all of that, but it's just what comes first and what's put on the end instead of the other way around.
Right. And what's the context? So if someone's coming into a community-based clinic, they're going to be coming for something that is not acute. Or if they are coming in for something that's acute, because I have that acute care training, I'll quickly identify my center as not being the correct setting, even if my training is appropriate for acute care, which it is, but you need the right setting. And so we're seeing people, right? And the overwhelming burden of disease in this country has to do with chronic conditions for which acute care, it's just, right? It's about the right paradigm, the right setting for the right problem. And thank you for speaking about evidence-based medicine, because that is the gold standard by which I was trained, and very much practicing evidence-based medicine. When we start broadening the body of evidence that we're gathering, and we start looking at deeper levels of hormonal testing, where we're looking at adrenals and we're looking at a full thyroid panel, and we look at markers like glutathione, and we look at markers for our energy generation. So we make energy at the level of the cell in a tiny magical organelle, the mitochondria, that requires B2 and B3 and B12.
And malic acid, which you might not even know is missing unless you do that deeper testing.
Right. And then you can look at some of the markers that we do have available on our quote unquote routine testing, carnitine, CoQ, and also the things that might be mitotoxic, again, the metals that I mentioned. And it's incredible what we can learn and we can practice, and then we can watch those labs change. And even if the intervention is dietary, when you do a repeat round of labs, you can watch how those markers change. And therefore we are practicing evidence-based medicine. And if the markers aren't changing, and if you're not feeling, importantly, what's the clinical picture? How does someone feel? How does someone function? And if we're not moving the needle there in a positive direction, then we go back to the drawing board and we say, all right, well, what are we missing?
I'll tell you one of the things we used to do in our weekly meeting. First of all, we took a photograph of every patient as they came in those days. It was a Polaroid camera, by the way, which natives say capture your energy field, and they didn't want you to use it sometimes. But we had that in every chart. And Dr. Corsella, when we had our weekly meeting, and we would each bring in someone who isn't moving as well along as perhaps, most people do, or what would make us satisfied and the patient satisfied, we would sort of pray over the picture in a non-denominational way, because we'd ask their permission when they first signed up, because we're not praying in a religious sense, but we're sending energy fields to them through the picture, which is truly a radionic intervention. And, we could sometimes get what is that block, what is it, and move it to the next center, because we're so involved in the energy field as well as the chemistry.
What I love what you're saying there also is the fact that you're meeting as a team, and that there's this team level consciousness that you're bringing to the care of each individual. That's absolutely divine.
Yeah.
How beautiful.
That was wonderful. I really looked forward to it. And she'd also assign each of us a deep literature dive about some concept or other to bring to the table. Dr. Jeff, let's talk about glutathione next week. That means he better come prepared to tell us all about what is it, what foods are in, how does it interact. It was such a wonderful experience overall.
Ellen, I can't believe I'm on your show and I'm getting all of these practice meeting ideas from you. Thank you so much.
Well, we actually have to end, so thank you so much for being our guest today.
Thank you so much for having me. It's such an honor and a great pleasure.
So we're speaking with our guest, Dr. Miriam Rahav, and you can find her at rahawellness.com. And I want to thank you all so much for joining us today. Thank you for tuning into Herbally Yours, produced in the studios of 90.3 WHPC, Nassau Community College, Garden City, New York. For further information, email us at whpc@ncc.edu. This is your host, Ellen Kamai, at naturalnurse.com, inviting you to join us next week for another edition of Herbally Yours. Until then, stay healthy.